My name is Sarah Maxwell. I'm the Director of Marketing at ThriveAP. At ThriveAP, we are honored to have an expansive faculty of expert speakers and advanced practice providers with impressive credentials and experience. Today, I'm going to take a few moments to get to know one of our speakers a little bit better and gain some of their advice for thriving in an advanced practice career. So without further ado, thank you, and please welcome Andrew Baker.
Hey, Sarah. Thanks for this. Appreciate it.
Yeah, thank you so much for joining us. And obviously from your background, you are a busy person in clinic today. So we're very appreciative of your taking the time to chat with us.
Of course.
So I'll just jump right in and tell us a little bit about yourself and your background. I know we were chatting previously that you have a pretty unique experience, I think, compared to a lot of faculty that we work with. So would love to hear a little bit more about you.
Okay, great. Well, it's always hard to summarize things when you're trying to condense 10 or more years into just a few sentences. But I started my career as a PA in Ohio, working at an academic medical facility, the Ohio State Medical Center. And this was a wonderful opportunity to kick off my career for a few reasons. One of which I was kind of thrown in with the residents in that program because, believe it or not, 11 years ago, there was not a lot of onboarding solutions for PAs and nurse practitioners. So this really gave me a high level overview of like what I was to be doing in my career, as well as training like one-on-one with residents who had a very, stringent couple years of residency. And really, I learned how to do a lot of surgery and sewing, which is what I do a lot of now. So throughout my career, I worked in a few different areas, but in the last 6 years, I work in dermatology full time. And a lot of what I do currently is a surgical dermatology, and that consists of like just your run-of-the-mill skin cancers, but also melanomas, and deciding how to best treat people with melanoma and skin cancer surgically and non-surgically. But I also have a big passion for inflammatory skin disease as well. These skin diseases really can burden people's lives and affect their quality of life. So I feel very fortunate that the science has advanced to the point that there's so many options for these patients. So that's in a quick nutshell about my practice, what I do. But as a new graduate, when I came out of PA school 11 years ago, I realized I had no idea how I was going to pay back my student loans, or really how I was going to manage any of my income that I was going to be getting. I felt very, ready and eager to start my career, but I realized I had no plan how to deal with loans, debt, or any of my income. So it was really at that time I started more self-learning and meeting with people, financial professionals, and just getting a better understanding about what decisions I was going to have to make in my career. And that went on for many years. People that got to know me felt that, just from casual conversations, some of my, PA and NP colleagues, as well as physician colleagues, we all just had casual conversations that turned into more of, me helping give them some recommendations about, what people should be doing as far as loans, retirement, and so on and so forth. So then in 2018, I decided, I've been a clinician for about 6 years now. I'm starting to feel comfortable with my clinical skills, and I felt that I could just do more for my colleagues. And so it was at that time I decided to go back and get my MBA. And it was an online degree, which is this is pre-COVID. So to me, this was a really big change to be a self-learner and doing it on your own, in addition to, family and clinical practice. But in May of 2020, I graduated with this degree, and I started working more specifically with PAs and nurse practitioners about financial decision-making, early career and late career, because there's so much to know. And while no one ever claims to know everything, I feel that this experience has really helped me, get other people way ahead of the curve and not be kind of digging themselves out of debt throughout their career, so to speak. So I love, diversifying my skill set and my knowledge, and I feel very fortunate to be able to do so.
Absolutely. Well, it's such an interesting but necessary area to kind of dive into. I think regardless of even if you're in healthcare or not, there's so many people who are coming out of school and they've got these massive student loans, and it's like, great, now I'm getting this job, but what do I do next, right? How do I manage this? And it's definitely one of those areas that is tough to tackle. And it's not super just clear, right? It's as
Mm-hmm.
clear as mud, as they say. It's
Mm-hmm.
it's a difficult area to understand fully. So I think that's something people need more education on.
Mm-hmm.
So would you say that maybe that piece is your greatest passion in your role, or is it still more on the clinician side, or is it kind of a little bit of both?
I would have to say it's both. It'd be difficult to give an exact like percentage or number, but at the end of the day, like I love what I do, whether it's treating patients with a terrible skin disorder, curing them of cancer through a surgical method, or having a quick conversation with someone in the evening to help clarify some of these tough decisions they're going through in their life. It's all part of who I am and what I want to continue to get better at. So it's really just great that that technology is at the point where I can do all these things in one day, so to speak. And it's really great to have the, as time goes on, I think we all get better at things. And so as time goes on, I hope to continue to get better and continue to help more people, colleagues, and patients.
And if you had maybe one thing in your career that would you say that you would say is like the most noteworthy, or man, this was just an accomplishment that I had that felt so near and dear to my heart, what would that be?
It would definitely be something with patient care, because I still feel, while I want to, help as many people as possible, I love surgery and doing skin surgery, and getting better at that, and constantly kind of tweaking and modifying how you're doing things to have better patient outcomes and better clearance of skin cancer. I recently was able to do like my 10,000th skin surgery, which was probably one of my biggest accomplishments that I would say. And it's something that's been over 11 years, and I do about 30 plus skin surgeries every week now. So I would say that's just something that didn't happen overnight, and I feel very thankful to have the ability to do that, and I can't wait to get to 20,000.
Yeah, that is impressive. Congratulations. Just then casually, you also do all of the financial discussions, and then
Mm-hmm.
also are part of the ThriveAP faculty. So
Mm-hmm. Mm-hmm.
sounds like you've got tons of time on your hands.
It's all about time management, and I think that probably as well.
Yeah, certainly. Well, so tell us then, what did attract you to become a speaker at ThriveAP and to join our faculty?
Well, I think even though it's been a few years for me personally, I think all PAs and nurse practitioners can revert back to when they first started, and this necessary or this really difficult time where they're learning to, be a clinician, because there is so much to learn. Learning curve is so steep, I would say, for everyone. Some specialties maybe a little bit more than others. But we had a new grad nurse practitioner like last year, and her and I were kind of talking about some things and starting your career. And I just felt that there was just this need to have a better transition into practice from your education. And I really feel that ThriveAP is doing this and helping people, cut down on the uncertainty and the onboarding necessary, and just kind of stepping into the role. And I don't want to say, hitting the ground ready to run, sort of, however, but just being more prepared for the job to help their employers, can know that they have less turnover because these people are ready for practice, and all those things I wish I had available to me. And I want to help people who are starting their career, and anyone for that matter. But I think ThriveAP is doing all those things.
Thank you. Yeah. I mean, we feel really strongly about that transition into practice and what that means. You mentioned earlier, getting to do all these surgeries and providing this better care and having the outcomes that you get for your patients. That's something we're passionate about, that if you handle the transition to practice for NPs and PAs formally, you really support them, because you mentioned earlier too that wasn't always a thing. And I think it's still not as prevalent as it should be. That people do have those better outcomes, and that patients are happier and more satisfied, and clinicians are more satisfied. And it's that bridge, right? And so it's something we take really seriously, and we've got to make sure we do this right.
Mm-hmm. Yeah, very well said.
Yeah, and part of that is the right faculty, right? Having people as passionate as yourself and as experienced as yourself, who can come in and talk through those best practices and say, hey, I just learned this new thing, this new greatest technology that is new to this field that you can leverage. Let me talk to you about it, right?
Mm-hmm. Yeah, exactly.
So speaking a little bit on that vein of supporting your fellow APPs and helping develop them, what do you think are some attributes that a good mentor would have?
Transparency is one of them. No one's perfect. No one started their career knowing all the answers or being able to navigate all these uncertainties that happens in our lifestyle as clinicians, and just letting people know they're not alone. I can recall when I made this mistake, or when I had to, do extra learning, or, work with an organization that can help me get better at what I do. Because, when you look at someone that has, 10 to 15 years experience to somebody new in the field, it might seem like they know everything, and it's very admirable, but it takes time, a lot of time. And so having a mentor that's transparent and being honest with you about their struggles and, what worked for them and what didn't work for them, I think is really important. But then experience too, I mentioned earlier, and I think you could ask a lot of different people and people might give you all a different answer. But how long were you in the field before you started feeling, I'll kind of just loosely use the word comfortable? Because, sometimes you don't know what you don't know. And when you're out there, it can be an eye-opening experience. And there's definitely the need to have years of experience before you can truly feel like you are comfortable with that. It's not to say that people learn at different speeds, that people have better experience than others and better, training and onboarding, but there's just definitely some truth to being out there for a while and being an expert in the field. And that's something that I'm always striving to be better at. But it certainly comes with time.
Yeah. That's a good point. We had Veronica Hill and I were talking to some of our alumni last week, I want to say. And we were just discussing, having like a great conversation and brainstorming. And one of our alumni brought up, I didn't know what I didn't know. And I wish if I could go back, that hindsight is 2020 feeling of, I would have asked some different questions during my clinicals. I would have paid more attention to this, or what was being prescribed, or this piece that I didn't know to ask that, or I didn't really realize how important that would be, that was something I should note down or try to memorize. So I think that's such a key, is having that person you can go to and they can be like, listen, I didn't know either, and here's something I learned, or here's somewhere that I went to help me find this information more readily available and more up to date.
Yeah. And that's exactly what ThriveAP is doing. They're helping clarify these uncertainties, because there's so many variables going on in all of our lives at that time. And, to have an organization that's helping clarify them is so important. And as well as just when you pick your first job, how do you pick retirement? How do you pick, disability insurance? What do you do with that? And unfortunately, there's a lot of people out there that, even though they might market themselves at being, in your best interest, it's not always the case. So there's lots of variables there, and it's just good to have more resources out there.
Yeah, absolutely. And kind of speaking about resources, are there any specific ones that you use on a regular basis that, journals or apps or podcasts that you check to kind of stay up to date or check in if you're looking for an answer?
And yes. And it has evolved over time, and I would expect it to continue to do that. Kind of in dermatology, I focus on a lot of the dermatology journals. There's a few notable ones. At the Society of Dermatology PAs is one that I follow very closely, because I was recently elected to be their director at large starting July of this year. But so that's one. There's lots of other journals out there for physicians and there's this PA nurse practitioner one that's really amazing as well, that has a lot of updated journals and just best practices that are available, standard of care adjustments, algorithms, new publications. In our world in dermatology, the biologic medications have exploded. And so there's lots of questions and uncertainty about how do you choose the right medicine for the right patients, what side effects are available, And that, that's a very complicated set of questions for clinicians and patients for these. So there is tons of resources out there in dermatology that I personally look at. I'm probably not the best person to ask for other ones, because dermatology is a really specific, specialty. But that's kind of how I do things. But then I use like UpToDate as well. UpToDate has a lot of good information. I still enjoy some of the good old-fashioned textbooks. I know a lot of people don't, but sometimes it's nice to have a reference at your desk you can flip through, even though it might not have the most up-to-date information. But for disease states and just kind of natural history and things like that, I like to use basically all those things.
I get that. Being in marketing, I have some of those different books for dummies, that every once in a while, it's something that they didn't teach in school when I was going through my undergrad, that then I've had to learn on the fly in practice and in digital marketing. And then I got some of those books, and every once in a while I'll go back and be like, gosh, I haven't done this in a while. How do I get started? What are some of the foundational pieces? And then I can figure it out. Right.
Yeah.
So I get it. So what advice would you give to APPs of today as they enter that next stage and help them prepare for a successful future?
It's okay to ask for help. During your education and training, people are in place to provide you help. But as you start to branch off into more independent practice, it's okay to ask others for help. And we've mentioned just a few options here that are available for you. And utilize them. These are resources created to help you be the best version of yourself and have the most meaningful career in taking care of your patients. That is something so many people feel like they're too smart to ask for help. They have these degrees, they don't need to ask for help, whether it's in clinical practice or beyond. That it is so important to do that, and just know that you're not the first one that's ever done that. That's number one. I would say number two would be just work for a few years. It's okay to have some, uncertainty and maybe consult your collaborating doc more often, or have more questions early on in your career. You only get one shot to start off your career the right way. So if you're just not sure about what the best way to treat someone is, or follow up, or when to refer, you got to collaborate people who have been there and been working longer, because you want to get these good, healthy habits now that will carry throughout your career. And then the last thing, this was some of the best advice given to me when I was in your stage, and I still think back on this now, is if you're in the situation where you're choosing a job or transitioning job, and a lot of what I do, this might sound counterintuitive, is teaching about finance, but take the job that's going to teach you the most and not pay you the most early in your career. I think if you look at, there's probably, out of 100 people, there's probably a few people that would argue that, but most people, believe that if you are trained appropriately, you're onboarded appropriately, and you have the necessary knowledge and skills early on in your career, it will carry with you throughout and teach you to be the best clinician possible. Just don't chase money. There's more to life than that, because burnout is real, and you need to be mindful of that early in your career. Although we all have debt, we all had debt coming out, most people did, and there's lots of ways to get into further debt. Money is important, but it's not everything.
I think that's really sound advice through and through. I think asking for help is always difficult. I think human nature is to have a little bit of ego involved, and admitting that maybe, hey, this isn't my strongest skill set, or this is something I just don't know. I think a lot of people struggle with that. And I do think the place where you can learn the most and gain the most experience, I think specifically for advanced practice providers, because there's so many specialties and paths you can explore, that going somewhere where you can find what is the right fit for me, so that you can move into a field that you're really passionate about. Because, we hear often folks who are like, oh, I knew I was going to be orthopedics, or I was going to be cardiology. And then they get this experience in something like dermatology, and they're like, it changed my life. It blew my mind. I was so passionate about learning this, and I just dove right in. So being somewhere where you have that experience and you can learn and grow, I think that's crucial to avoiding that burnout and finding true passion within your career.
Yes. And I was that person you just described. I went to PA school because I was going to be in orthopedics. I had shoulder surgery. I was a PA, I worked with there. Like, there was no option that I was not going to work in orthopedics. Even though I had a couple of job interviews and offers, I have yet to work in orthopedics. And again, nothing against it personally, but that just how my career, shook out. So that's just important, I think, for others to realize that you can, being adaptable and moldable and finding what works for you is just so important. And as a APP.
I didn't know, I promise.
Yeah. Funny you mention that.
That was just very kismet.
Yeah.
Well, thank you so much for joining us today. I think all of the information you shared is really beneficial for folks, especially these earlier APP career as they enter and transition into practice. This is some really key career advice that they can take and hopefully follow for a successful career and following your footsteps and being passionate and finding the area that they're most passionate about.
Yeah.
So thank you for joining us today. And
sure.
And thank you for everyone for joining us as well and listening to us. So please stay tuned as we meet more of a faculty, and have a great day.
Thanks, Sarah.
Thanks, Andrew.